Hello, Rebecca and everyone there in New Orleans. It is great to join you. I thank you for your patience this morning. I knew I wanted to be there in the room with you for many reasons. One of them now is tech fail. So I'm glad to join you today. I just want to thank Rebecca and the University of Chicago Health Lab for all of their work bringing us to this moment, and especially for the tireless commitment to equity in our nation's emergency response system. Thanks as well to the work group co-chairs and members for putting together such a thoughtful blueprint for transforming our 911 network. I'm also grateful to the Orleans Parish Communications District for serving as our hosts, and to everyone attending today for your interest, for your contributions, for the vital role you all play in responding to public safety and public health emergencies in communities across the country. I have the great privilege of leading an office that's dedicated to supporting and improving community safety and well-being. The Office of Justice Programs awards grants, we provide training, we support research, and we offer many other forms of assistance, all in an effort to build safe communities and serve the cause of justice. In our work, we're constantly making the case that public safety, including emergency response, is not the responsibility of law enforcement alone. As we all know, in many cases, community emergencies, whether they're drug overdoses, psychiatric episodes, people struggling with homelessness, these are not simple law and order matters. But over time, we have as a nation created a system that has placed the burden of responding to emergencies on law enforcement officers, on firefighters and EMTs. What we found, however, is that when we treat every emergency as a threat to public order, we see all emergencies from the lens of criminal justice system. Instead of getting people the help they need and referring them to treatment and to services, we often arrest them, sometimes lock them away. And this outcome is far from ideal. We've developed a habit in our country of criminalizing substance use, mental illness, and other societal problems. And this has been counterproductive from both an individual wellness standpoint and from a public safety perspective. It is past time that we acknowledge the damage we're doing and change our approach. Jurisdictions across the country are discovering in these calls for service an opportunity for intervention. A number of cities are deploying innovative co-responder models that pair treatment providers and health professionals with law enforcement on 911 calls. For over 2 decades, our Bureau of Justice Assistance has managed the Justice and Mental Health Collaboration Program, which supports cross-system partnerships that improve responses to individuals in crisis. Just last year, we launched a new effort under this program called Connect and Protect, aimed specifically at supporting crisis response strategies that are built around collaboration between law enforcement and behavioral health professionals. I think we need to continue investing in these strategies and be open to expanding partnerships between the justice system, the health, substance use and mental health fields, and community providers. This collaborative approach has worked well in other areas of public safety. For example, in helping people who come out of our prisons and jails reestablish themselves in their communities. Over the course of my career, I've been very active in promoting effective reentry as a solution to community safety challenges on the back end of the system. And I've seen that these partnerships can work. We should take a similar approach on the front end of the system, encouraging cross-disciplinary cooperation in our emergency response systems. In jurisdictions that use co-responder models, people with serious illness are getting treatment in the community and they're avoiding jail. By not depending so heavily on law enforcement resources, some cities are saving substantial money for refocusing law enforcement attention to where it's needed most. We have a number of resources to help jurisdictions adopt these efforts. Our 14 law enforcement mental health learning sites provide peer-to-peer support to help agencies develop response models tailored to their own problems and circumstances. In partnership with the Council of State Governments Justice Center and the University of Cincinnati, we've also created an interactive map showing how the nation's 70 largest cities are tackling these challenges. There is no one-size-fits-all approach in responding to community emergencies, but we're on the right path when we view these crises from a wider lens, not as police actions, but as community challenges. A just and equitable society, and ultimately a safe society, is one in which we're meeting the basic human needs without resorting to unnecessary and inappropriate punishment, without inflaming community tensions. I applaud your commitment, and I look forward to joining you as we build an emergency response system that is fair and effective, that reflects the dignity and humanity of everyone it serves. Thank you. Have a wonderful conference, and thank you.